Happening now, live at 9, and Delta Technical College are teaming up to spotlight outstanding high school students from across the greater Memphis area. We need your help to celebrate these hardworking teenagers from right here in our community. Parents and legal guardians can nominate any student between the ages of 13 and 18 who were enrolled in high school. Students 18 years old at the time of entry can also nominate themselves. So just head on over to our website, liveat9.tv, click on contests and fun, and then select Student of the Week presented by Delta Technical College. Fill out the online form, and your nominee could be featured right here on Live at 9. A Common Sense Media study says that AI is a go-to source when it comes to teenagers searching for personal advice, emotional support, and even everyday decision making. Stephanie Cole-Farris is the Clinical Services Program Manager at Youth Villages, here to talk about the use of AI and mental health. Wow, hello. Such a big deal.
Yes, it is. Really, the use of AI has increased so much with our children and teens. And a recent study even showed that 70% of teens have used some kind of AI. And so, although it was originally designed to help with homework and other types of things for academic advancement, now teens are using it even more for connection, comfort, interaction, socialization, and even to ask questions about mental health and to deal with everyday stress.
I even saw somewhere someone was like, oh yeah, this is my AI chat boyfriend. I'm like, whoa, you know. So people are really looking to almost like replacing humans with it. But and there's this mental health connection between the use of AI. Can you dig further into that?
Sure. So oftentimes our young people experience different levels of stress, and if they are looking for a place where they can air their feelings out and really just talk about what's going on, and they want to feel safe to do that, then oftentimes they will turn to AI for that and to chatbots and basically get involved in AI relationships for support with that. Where the risk is in that is that the information that AI can provide is very rote at times, and it is not within an emotional context. And so even though the child may be sharing a lot of very heavy emotions, that context is not necessarily included or taken into consideration when they're given instructions or directions or suggestions on how to handle something.
I mean, you work with children. Why is empathy so important?
So when we talk about empathy, we're talking about how an individual can really understand the feelings that someone is having, and they can share in that concern around those feelings and their emotions. And so when that is not available through AI, because AI is not capable of that at this point, then they are left with a situation where they may become very entangled in this and be very serious about their relationship with a chatbot, let's say. Yet that chatbot is not able to feel and therefore cannot interpret some of those very subtle things that are going on with the child. And so if the child is high risk, that might be picked up by a human, not necessarily a chatbot. And so then that's where the difference lies, is that the level of risk is not picked up on, and so they don't get the help that they need through that interaction or that relationship.
Wow, I mean, you touched on that, and so you're talking nuance, right? Nuance.
Yes, there's very subtle things that human interaction, there really is no substitute for it. Being able to explore what's going on when you're struggling in school, or if you're having some interaction with peers, with an individual who really can pick up on things that maybe even the child doesn't notice. And so when being able to do that, then with that human interaction, they're able to connect the child with the resources and the support and the help that they need.
Right, and even sometimes when you're looking into someone's face, they're saying one thing, or, you know, but I mean, with this, they're typing it. And so then just the connection between your head and your hands to type it out. And sometimes you don't know what you're really feeling. So this is such a critical thing. What are some of the things that you think caregivers and guardians need to really keep in mind when they're trying to explain this?
Sure, there's several strategies there. The first step that's extremely important is to be curious about what the child's understanding is of AI. Many kids are in different places with that, and so we can ask what experiences have they had with AI, and if they've had experiences, what did they like, what did they dislike, what did they think was healthy, about that or is healthy about that. The other thing that they can do is help make everyday conversations comfortable around talking about tough topics, big topics, things that teens and our children go through and they encounter every day in school or in peer interactions outside of school, and sharing various strategies to deal with some of the stress that can come from that as an alternative to feeling like they always have to seek that voice through an AI chatbot or through something else other than human interaction.
And what are some red flags that we can look out for, big red flags?
So with that, what we often see are significant changes in social interaction. We also may see very sudden mood changes with a child or an adolescent. And more extreme cases, there can be changes in their eating habits, also their sleeping habits. They may even share and talk about feeling highly anxious or highly on edge or something like that. There also are times where kids may talk about death and dying.
Oh, wow.
And so they may share that they've thought about dying, they've thought about committing suicide and things like that. And so those things are very significant and need to be handled very carefully, and certainly connect them with the correct helpful resources for that.
Tell us about the crisis resources that we're seeing on the screen right now. You have this.
Sure. So in Tennessee, we do have specialized crisis services offered through youth villages, and that's a 24/7 service that's available to anyone that is 18 and younger. And so with that, they're able to receive help and assessment where they work hand in hand with the child and with the family and anybody else involved with that case. But again, that is for minors, so it's going to be for individuals that are under 18 that need evaluation and support and services. And they can actually direct the family where to go to for additional help so that they can match up that risk with what the services are that will be most effective for them.
Stephanie, such a critical conversation. Thank you for bringing this to light.
Sure. Thank you so much.